Good morning, students. Today we will discuss about sixth semester subjects. So in sixth semester, you have mainly four subjects: child health nursing 2, mental health nursing 2, nursing management and leadership, midwifery, obstetrics gynecology 1. And there is a mandatory module to compute, that is SBA module under OBG nursing. That is for 6th and the 7th semester. So we will go through the detailed syllabus. We will see in detail the child health nursing syllabus. That is, you have 40 hours. That means 2 credits. Practical, it's 80 hours. And the child health nursing is designed to understand the modern approach in the child care identification, prevention, and nursing management of common health problems of neonates and children. So in the theory unit, you have several units. First unit is on cardiovascular system, congenital heart diseases, hematological conditions. The theory is 20 theory hours. Different units you can go through, and the second unit is on orthopedic disorders in children, 10 hours. Disorders of eye, ear and skin and communicable diseases in children. And the next unit is management of behavior and social problems in children, 10 hours. Theory, describe the management, and that is the objective of this unit. Enuresis, encopresis, psychiatric disorders. Okay, that's all about the 40 hours unit in the 6th semester, and these are the references books: Marlowe, Wong, DL and Hockenberry, Marilyn and Hockenberry, Berman, T. Premlada, Asoma Bibi, Paul V.K. Guy, Essential Pediatrics. This is a very important book. We used to study this books in olden days. Harban Singh, this is also a good book. And there are so many other books you can go through that is prescribed by your teacher. When you see the child health nursing clinical practical in 6th semester, you have 80 hours of clinical practical, and you are supposed to complete. The student at the end of the posting will be able to perform the children with health developmental anthropometric assessment, provide nursing care to children with various medical disorders, provide pre and post operative care to children with common pediatric and surgical conditions, perform immunization. You will have to use skill lab, use of manikids and simulators, endotracheal suction. Pediatric nursing procedures that you are supposed to complete during the posting is administration of medication, oral IM and IV, oxygen administration, application of restraint, specimen collection, urine catheterization and drainage, feeding, NG tube via nasogastric tube, wound dressing and suture removal. In the clinical practical pediatric medical wards, you will have there, you have to spend 1 week. The learning outcome is to provide nursing care to children with various medical disorders. You will be taking pediatric history, doing physical examination and assessment of children, administration of oral and IV medicines, fluids, calculation of fluid replacement, preparation of different strengths of IV fluids, application of restraints, administration of oxygen inhalation by different methods, baby sponge bath, feeding children by cutlery, spoon and Pallade cup, and collection of specimens, assisting with common diagnostic procedures, teaching mothers and parents, play therapy. So you will do one care plan, one case study presentation, and your evaluation will be done by OSCE or OSPI methods using checklist. Then clinical area, pediatric surgical ward. Pediatric surgical ward learning outcomes. In surgical ward, you have 1 week posting. There also you will write one care plan and one case study presentation. The various procedures you are supposed to do, that is administration of IV fluids, bowel wash, insertion of suppositories, care of ostomies, various ostomies like colostomy, ureterostomy, gastrostomy, enterostomy, urinary catheterization and drainage. Assisting in helping in feeding, nasogastric, gastrostomy and jejunostomy, care of surgical wounds. In neonatal ICU and pediatric ICU, you have 1 week posting. There you are supposed to provide nursing care to critically ill children. There your clinical assignment will be newborn assessment 1, and you are supposed to do a care plan. Okay, so there are various procedural competencies expected from a student. Is care of a baby in incubator, warmer and care of a child on ventilator, CPAP machine, endotracheal suctioning, chest physiotherapy, administration of fluids with infusion pumps, total parenteral nutrition, phototherapy, monitoring of babies, recording and reporting, and cardiopulmonary resuscitation. The next is mental health nursing. In mental health nursing, you have only 40 hours of theory and 160 hours of practical hours. Here, in sixth semester, you will be providing care to patients with various mental disorders. Like behavioral problems in children, substance use disorders, patients with organic brain disorders, and you will identify and respond to psychiatric emergencies and admission procedures in relation to Mental Health Care Act 2017, explain the roles and responsibilities of community health nurse. Here also you have in various units. Unit 1, nursing management of patients with substance use disorders. Second unit is nursing management of patients with personality and sexual disorders. The nursing management of behavioral and emotional disorders recurring during child and adolescence. The next unit, 5 hours unit, nursing management of organic brain disorders, and chapter 5 is psychiatric emergencies and crisis intervention. Then legal issues in mental health nursing, overview of Indian Lunacy Act, Mental Health Act. Okay, and then community health nursing is describe the model of preventive psychiatry. So various books recommended for Bachelor of Science Nursing is Mary Townsend, Essentials of Psychiatric Mental Health Nursing, Stewart, Gail W. Stewart, Principles and Practice of Psychiatric Nursing. Then you can refer ICD-10 classification book, textbook, then DSM textbook. Then Bharat Parikh, Judith M. Sheila Waidbach, Patricia Gacy. These are the various books recommended in the syllabus. You can refer any other book prescribed by your teacher, concerned teacher of the subject. Then you have a clinical practicum, that is 2 credit hours, that is 80 hours in mental health nursing. Then you will have postings in psychiatric OPD, where you are supposed to do a history collection, health education to the patient, observation report of the OPD. Then you have in child guidance clinic, you have posting that you are supposed to do a casework of one and report of different therapies, history and mental status examination. You have to perform and practice psychometric assessment. Then you have a posting in 2 weeks, posting in inpatient ward. There you will do history taking, mental status examination, neurological examination, assisting in psychometric assessment, then recording therapeutic communication, then administration medications, assist electroconvulsive therapy, then preparing patients for activities of daily living. You have to do you have to give care to 3 patients with various mental disorders, case study, clinical presentation, process recording, and maintain drug book for the same. Then you have posting in community psychiatry and radiation center. There you have 1 week posting, where you have to do a casework, visit the radiation center, conduct home visit, identifying individuals, organizing mental health camp, conducting awareness meeting for health counseling, and teaching family members. Nursing management and leadership. Here you have 60 credits, including lab, skill lab hours, also practicum 80 hours. This course is designed to acquire knowledge and competencies in areas of administration. Next subject is nursing management and leadership, that is you have theory 80 hours. Okay, in 80 hours you have health care and development of nursing service in India, management basics applied to nursing. Then you have planning nursing services, organizing, staffing, various units, directing and leading, leadership, controlling, organizational behavior and human relations, financial management, nursing informatics, information management, then personal management. So management of nursing educational institution, so that is establishment of nursing educational institution, planning and organizing, staffing and student selection, directing, controlling. Okay, so these are the various books prescribed in the syllabus for your reference. Alexander, Nursing Service, Anna Helen, Jogendravadi, Clement, Jean Barrett, Sukhbir Kaur, Jagjit Kaur, Textbook of Nursing Management, Chatterjee, then Neelam Kumari. But these are the various books. You can refer any other book prescribed by your teacher. Then this is a clinical practical also, 2 weeks uh, uh, practical is there. Then you have another subject, midwifery, obstetrics and gynecology 1. That will continue in 7th semester also. Here you have 60 theory hours in OBG. And these are the various course outline. You can see chapter 1, introduction to midwifery. Then you have next unit, anatomy and physiology of human reproductive system, and conception, maternal, fetal and newborn physiology. Then you have assessment and management of normal pregnancy, antenatal. These are the various units you will learn in 6th semester. Okay, 3rd trimester. Then physiology and management of care during labor, various stages of labor. Next unit is preparation, postpartum care, ongoing care of women. So these are the various subjects, and you have a mandatory module in OBG. These are the various recommended books for OBG: Nima Bhaskar, Midwifery and Obstetrical Nursing, Datta, Shobana Naidu. All these books, various books, Mudaliya. You can refer any other book prescribed by your teacher. In 6th semester, you have 40 hours of clinical and skill lab 40 hours, and clinical you have 240 hours. Various competencies you are performed to supposed to perform is counsel women and their families on preconception care, demonstrate lab tests, perform antenatal assessment of pregnant women, assess and care for normal antenatal mothers, assist and perform specific investigations for antenatal mothers, conduct child birth education classes, organize labor, counsel women on family planning. Then skill lab, urine pregnancy test, calculation of EDD, obstetrical score, gestational weeks, antenatal assessment, counsel antenatal mothers, then micro birth planning, PV examination, a lot of procedures you are supposed to do. In clinical posting also you have 6 weeks posting. There in antenatal OPD you have 1 week posting, and for labor room you have 3 week posting. You are supposed to do partograph recording of 5 patients, PV examination of 10 patients, assist in conduction of normal birth. Then you have postpartum clinic and postnatal ward, including 2 weeks posting. So that's all about the 6th semester subject.